Karishma Manser. Is he here? I am so sorry. She is here from Exeter and has asked for 3 minutes. Welcome, Dr. Manser. Go ahead. You had a question to start.
And if anyone wants to take a stretch, if I
That's-
start, I don't want people to fall asleep.
That's my job, doctor, to manage
Listen,
that.
thank you, Chairman.
And our members know that they can get up when they need to, except for me. I stay here. So welcome.
Thank you very much, Representative Moffett, and thank you very much to all the representatives here. My name is Dr. Karishma Mansoor. I worked in clinical research for over 20 years, especially in epilepsy and depression. I worked with people with major depression, and what happens with major depression is that you are unable to work, and therefore you are dependent on public insurance. And many of these folks could not afford the insurance, they could not access the insurance, and many of them were suicidal, and they did commit suicide. I did leave medical research, and I am not going to talk about my other higher aspirations at the moment, but I am hoping that one day I will be in the halls of Congress to support Medicare for All. So let me see. I wanted to just talk to you a little bit about some data. Again, I'm a scientist. I like to use numbers. The current system, whether it's Medicare, Medicaid, private health insurance, VA, costs us $5 trillion. $5 trillion. The Congressional Budget Office has estimated that if we move to Medicare for All, which will cover every single person in the United States, it will cost us $4.3 trillion. So from a fiscal perspective, it is a no-brainer. We have to move towards a universal health plan. The other numbers that I want to tell you about is if we don't look at what is happening on an annual basis in this country, we lose 50,000 people. 50,000 Americans die each year because of underinsurance or lack of insurance. The population of Concord is 45,000 people. We're wiping out a group that is the size of this city on an annual basis. That is a national security threat. And yet, in the halls of Congress, nobody's talking about, enough people are talking about a universal health care plan. And in Congress, it's actually a bipartisan failure. It's a Republican failure, but it's also a Democratic failure. Only a few people are co-sponsoring Medicare for All. We need a universal health care plan. Tell me another universal health care plan that's out there. Has anyone else offered it? Medicare for All is the only universal health care plan that has been offered both in the House and the Senate by Senator Sanders and Representative Jayapal year after year. But too many members of Congress do not support it. Why? Because big hospitals, big pharma, they're all making money from this broken system. They're making money from the fact that people are suffering in this country. Let's see what, I also want to mention one thing. The difference in life expectancy between a poor American and a rich American at the moment is 10 to 15 years. A poor American, on average, will live a shorter lifespan than a rich American, and that has partially to do with the healthcare system. Anyone who is pro-life or pro-human life or pro-decency, pro-dignity should actually be very worried about this. Another thing I do want to mention, and I think this is partially to do with the fact that this is a for-profit system. It is benefiting a lot of people. It is not benefiting Americans, but it is benefiting a lot of people. Those are the people in Wall Street, the stockholders of health insurance companies, the CEOs of health insurance companies. That is unacceptable. We are allowing medical murder in this country just so some people can make more money. Some millionaires and some billionaires can make some more. The way we should look at healthcare is not as a business enterprise, as a for-profit model. We should look at it as a public good, like fire department or police department. Would you ever ask, hey, did the fire department, was it profitable last year? Is it losing money last year? Maybe we should shut it down. No. Every year, my taxes are supporting the fire departments in my town and my police department. I haven't had to call them in years. But the day I need it, I am glad that they're just a call away. Healthcare should be exactly like this, available to everyone when they need it, and to everyone, not just the people who have a job that offers the healthcare benefit, or somebody who's rich and that can afford it. So I'll stop there, Representative Moffat, but if you allow me, I would like to answer a couple of the questions that were offered by representatives earlier.
Please.
Representative Belcher, you asked, I believe, Representative LaMontagne about another country that offers as good a quality healthcare as the United States. I believe that was your question. So it was early. So I should tell you, first of all, universal healthcare is offered in all other developed nations, whether it's the United Arab Emirates or France, Italy, Germany. Germany has an unbelievable healthcare system, fantastic healthcare system. My son has food allergies. When we were traveling in Germany, he had an anaphylaxis reaction. We took him to the ER. We saw the physician. He received his care. We stayed for several hours. Once the physician released him, we came home and we received a bill for that. We had a similar problem when we were traveling to Maine, and again, he had an anaphylaxis reaction. Both of those bills from Germany as well as from Maine was covered by our health insurance. We're lucky to have health insurance in our family. And the care was absolutely the same. The German bill was $250. The Maine bill, the United States bill, was $5,000. That is what we're talking about. Absolutely exactly the same level of care. We had health insurance, so it was able to cover both, but many people don't have health insurance, and that $5,000 becomes a medical debt. Over 500,000 Americans each year are going bankrupt because of medical debt or dental debt. And sir, may I answer Representative Plant? Okay. Representative Plant, you mentioned something about whether it would cover gender-affirming care or, I believe you said, abortion care. I personally, having worked with patients and also being a human being and living in the live free or die state, I think the decisions about any human body should be made by the patient, their healthcare provider, and their loved ones, not anyone here. If nobody else basically should be making that decision. We should not be in anyone's bedroom, and we should not be in anyone's doctor's room. So I hope this was...
That doesn't answer my question that I asked, but thank you.
Representative Plant, because people are watching, they're going to be curious as to what your question was, and I'd like to have this
Sure.
clear.
Please, thank you.
While we're on this, so that people don't go away wondering what was his original
that's
question.
True. Fair enough.
To restate my question, it was simply, does the current legislation at the federal level for the Medicare For All Act call for funding for abortions and gender assignment care, reassignment care, or affirming care?
Medicare for All is going to expand on the current Medicare system and provide dental, vision, and long-term care. That level of specificity is not in the legislation yet. But support Medicare for All. Let it go to Congress. Tell our Congress members, neither of our senators, neither of our representatives have ever co-sponsored Medicare for All. They are Democrats. Tell them to co-sponsor Medicare for All, let it go to Congress, and then hash it out, what should be paid and what should not be paid. But at the moment, but again, I stand by my statement that I hope all of us will respect bodily autonomy and not enter anyone's bedroom or anyone's doctor's offices to decide for them what to do with their body, with all due respect.
Thank you, Dr. Manzer. You've already answered some questions, and I haven't even asked you if you'll take questions. So thank you for responding
Yes, I will take questions.
Representative Belcher and Representative Plant. Are there anything else? Go ahead, Representative Belcher.
Thank you, Mr. Chair, and thank you for taking another question for me.
Thank you.
I want to look specifically at just a little bit of the testimony that you gave, because I don't necessarily disagree that there's some ugly things happening.
Yes.
I don't disagree that there's some greed involved. I don't disagree that there's a lack of ethics involved in a
Yes.
number of different ways.
Yes.
I don't disagree with that. But you specifically said, I believe, that the insurance companies are responsible for medical murder. Murder is a very specific term.
Yes.
It's a legal term.
Yes.
Murder justifies self-defense. We've seen a significant rise in violence. We've seen multiple assassinations, including the killing of a healthcare executive in New York just a year ago. So can you elaborate a little bit on what you mean?
Absolutely. Thank you very much. Thank you. The term medical murder is because if you know somebody needs a care to survive and you deny them that care, in a sense, you are giving them a death sentence. So I'm going to give you an example of one of our people here in New Hampshire. Their loved one had cancer. They had health insurance, but the health insurance denied the care. The person died. The physician had prescribed the care, but the insurance company decided not to pay for it. The person died. That same year, the CEO of that health insurance company made $15 million just in profit. Why are they able to make that much profit? Because of the denial process. They deny. More denials means more money remaining within their coffers and to give it out as bonuses. So yes, medical murder is a term in the United States. Thank you. Again, to go back, why are we allowing people to benefit off of other people's health? The whole model needs to be absolutely changed and obliterated. To go to Representative Mandelbaum's question earlier, why don't we have a public option? Then you're also almost saying this is a system that's kind of working and the public option will be a Band-Aid. We have to dismantle the current system. The current system is not working. The current system, it's like buying a lemon car and trying to fix it. It is not. It's a clunker and it has to be replaced.
The prime sponsor is behind you, shaking her head in the affirmative. That will be seen on television. We need to press on.
Sorry.
Dr. Muser, thank you so much. Was there another? One more, Dr. Baratuki, Representative Baratuki.
Soon to be. Well, there is no denying that the current medical health insurance system, medical system, not working. It's working for them as designed, but not for the American people.
Correct.
So the question is, do you care saying anything to the healthcare corporations that profit off of illness and to the elected officers who protect them by opposing Medicare for All?
Yeah. So the system, you should have a patient, the provider, and a single payer system giving money back to the provider for providing care. Why do we have, to begin with, a private health insurance system? It just doesn't make sense. If you're talking about fraud, waste, and abuse, this is fraud, waste, and abuse. The whole healthcare system. So if you want efficiency, if you want fiscal responsibility, if you want small government, this is where you have to actually go. So the health insurance CEOs, what would I say? One day you'll have to answer to your maker. And it's not going to be a good look.
Thank you, Dr. Manzer.
Thank you very much.
I have two more cards here. I have a gentleman from Samberton and a gentleman from Exeter. From Exeter is Charles Fanning. Is Charles here? Charles, welcome. He's asking